Hey, good evening, guys. We're going to get started in one moment. Okay, guys, let's go ahead and get started. So, tonight we're going to be going over some study tips. So, for anybody who is preparing for certification, I am going to be giving you guys some study tips tonight. And then, anybody in the chat that's watching, you can always feel free to add some tips as well. If anybody here is preparing to take their test, do me a favor and put in the comments, just let us know which test you are about to take and when. So let us know, just put it down in the chat. If you're watching a replay, you can just put it in the comments. Just put which test you're taking and when. And we're going to get into these study tips. One thing I'm just showing you guys on my screen now is my online study guide, MA Refresher Course at marefreshercourse.com. It is filled with modules, with lessons. I also have practice questions in there. I have over 400 practice questions there, so I definitely wanted to make that available to you guys. In addition to the videos that I have on YouTube, I did create an online study guide, an online refresher course. So it's for anybody who's taken their certification exam or for any medical assistant who has been in the field for a long time and just need a refresher. Okay, so I see you guys putting in the chat which test you're about to take. Okay, Instagram, I see Casey says on the 24th, CCMA. Okay. All right, guys. So I see you guys are putting those comments in. So again, guys, marefreshercourse.com. If you need an online study guide with lessons and practice questions in there. So let me go ahead and I'm going to stop sharing my screen. Okay, there we go. Now we back. All righty. Let me know if you can see me now. It looks like my internet is acting up. And let me know, guys, do I look dark to you? I'm looking from my phone and it looks really dark, but on the computer, it looks like it's light. So let me know if you can see me and how it's looking. All right, let me go on Instagram. Okay, guys, so we're going to get ready to get into these tips. Okay, thank you guys for letting me know. Just want to show you guys again my mug, my medical assistant mug. This was created by my graphic designer. He also, you guys know, y'all know I got everything medical assistant. My t-shirt, he created my t-shirt too. It says certified medical assistant. He developed all of this for me, my graphic designer. So all of this, like my t-shirts and stethoscope necklace and all that stuff. Oh yeah, let me show you. I gotta show y'all my pillow that I got behind my back too. This is, oops. Again, he developed this and I just added it to different products. So I had to show you guys that too. I'm gonna go ahead and link that for anybody that may be interested. I'll just link that in the chat. No pressure, guys. I don't want to be all salesy and stuff, but I definitely want to promote my stuff. Morgan said, I love the cut. Morgan, I have it in different colors too. So this one is pink and in the inside, and then I have mugs that are black. They all have this design, but some of them are pink in the inside, some are black in the inside, some are purple, some are white. So whatever color you want, you can choose. So I just put that link in there. Hey, MN. All right, guys. So let's get ready to get into it. Quizm said, I love them all. Thank you. All right. So let's go over these. I'm not going to do a slide presentation today, guys. So don't worry. It is not a slide presentation today. Okay. I am just going to talk to you guys. If you see me looking over, that's because I made some notes that I'm going to be looking at on my other screen. But I'm just going to have some things popping up on the screen. Okay. Now, these are not necessarily in order, but these are just things that I want you guys to write down. So for anybody that's about to take the test, make sure you make a note of these tips that I'm going to give you. And then also, if you happen to know somebody that's about to take the test, of course, you can share these with them as well. So the first tip that I'm going to give you guys is to familiarize yourself with the structure of the exam. So what does that mean? That means doing exactly what we did on the live yesterday. I purposely did that live yesterday before we did this because I wanted to show you guys how important it is to look at the structure of the exam. As we saw with each of the exams, the majority of the test is patient care, right? So you want to familiarize yourself with the structure of the exam. You want to know what percentage of the test is law and ethics, what percentage of the test is, anatomy and physiology. Now, every test is different, though. That doesn't mean that your test is going to be like somebody else's test. However, it is good to know what is going to be on the test. So the majority is patient care. When I say patient care, that's everything dealing with the patient, vital signs, assisting with different procedures and things like that. Okay. So if you missed yesterday's live, make sure you go on google.com, and look up the test plan for the test you're taking. Can you guys hear that? Let me know if you guys can hear that noise in my background. I'm washing clothes and it's kind of loud, so I can stop it if you guys can hear it. So again, familiarize yourself with the exam. Just if you're taking a CCMA, go to Google and look up CCMA test plan, and then use that as a checklist, okay? For just to make sure you know everything that's on. Okay, Quizm said they can't hear. Okay, good. So use it as a checklist. Okay, so that's the first thing I'm gonna tell you guys. Familiarize yourself with the structure of the exam. And let me take this one off. The next thing that I want to talk about is creating a study schedule. You got to make time for your studying. I don't mean just saying to yourself, okay, I'm gonna study every night this week. No, literally create a study schedule. I am going to study between, and I'm just throwing a time out there, I'm going to study between 8 p.m. and 9 p.m. And I'm going to break down the study material in different chunks. This is what I'm going to go through tonight. Tomorrow night from 8 to 9, I'm going to go through law and ethics. This night, I'm going to go through anatomy and physiology. This night, I'm going to go through compliance. This night, I'm going to go through with something else, patient care or whatever. Create a schedule. And when you create that schedule, you're going to guard your time. What does guard your time means? That means that you're going to eliminate distractions. That means you're going to guard, like you literally guarding it, right? GUARD. You're going to guard that time by making sure nothing interrupts it. So like your cell phone is going to be off. There's not going to be no distractions. If you need some music on while you're studying, I understand that, but you want to have the TV off, no social media. Okay. So create that schedule and guard your time. Okay. And then break down each topic into manageable sections. When you're trying to do too much at a time, it's going to get overwhelming. And so this is going to take me back to number one about getting familiar with the content. When you download the test plan, just take each of those sections and go over that each night. Okay. Because when you look at that test plan, it's a lot. If you try to look at it, y'all, if you were on here last night, you saw it. We scrolling for days. That's a lot. But if you say, okay, Monday night, I'm going to go over this part of the test plan. And then Tuesday night, I'll go over this. It just becomes more manageable. Okay. So let me go here. The next thing, let me look at these comments just to make sure you guys are still with me. Yeah. Okay. All right. Let me hide this one. So the next thing that I'm going to show you is use study materials for the exam you'll be taking. Okay. So if you're taking the CCMA, you should have study materials for the CCMA. Same thing as an RMA or CMA, whatever test, CMAA. get some study materials, guys. I know that you all want the Quizlets and anything online that you can find for free, but if your school is not providing study materials for you, just get it yourself. If you cannot get both the practice test and the study guide, I at least, at least get one of them, okay? Or I put my refresher course there. I made my refresher course very affordable for a reason, because I know the study material can get expensive. So I purposely made it very reasonable so anybody can afford it, okay? But you got to get the study material, and and your life should be revolved around that study material while you're getting ready to take your test, okay? And the thing about Quizlet is a great resource. It's wonderful. The only thing about Quizlet, the reason why you want to be careful with it is that sometimes there can be mistakes. There have been times where I've gone through something that somebody uploaded on Quizlet and there were mistakes. So just be careful. And then, like, I've talked to people who created their own Quizlets as well from their notes. So that's an option too. All right, the next thing you want to do, you probably already know about this, guys. Take your practice test. If you can only get one or the other between the study guide and the practice test, you're not able to get both. At least get the practice test. And the reason why I say that is because the practice test is going to pretty much give you everything you need. And what do I say all the time? We're not going to focus on the practice test and try to memorize them. We're going to focus on the content. The practice test is going to give you an idea of what kind of questions are going to be on the test. And when you're taking those practice tests, what do I always say? You're going to pay attention to those wrong answers too, because guess what? The wrong answers are probably going to be on the test. This is why I say, if you can only get one or the other between the actual study guide and the practice test, get the practice test, because when you're going through the practice test, they show you the correct answer and they explain the wrong answers. Okay. So at least as you're going through them, you're getting something, you're getting what you need. Versus if you can only get one and you get the study guide, you're not going to be familiar with what kind of questions you may have. Again, don't try to memorize the question, study the content. And what I mean by studying the content, I didn't realize that some people didn't know what I meant when I said that, because somebody asked me the other day, what do you mean study the content? I mean study the content in the sense that you are absorbing what is in the questions and not just memorizing them. So you know how I just said, pay attention to wrong answers. So if you have an answer, you have a question that's asking you, okay, which of the following is the form that Medicare patients sign, acknowledging that Medicare will not pay for this service. And you see the option for ABN, you see the option for EOB, AOB, and COB. What I mean by study the content is that you choose your answer, which is ABN. And then you also want to make sure you know what COB means, coordination of benefits. What else did I say? AOB, assignment of benefits, and EOB. So make sure you know what every option means. And if you don't know it, go find out. Okay. Let me scroll down a little bit. The next thing that I want you guys to do is focus on your weak areas. Okay. That doesn't mean that you're not going to review your areas, your strong areas, but this means that you're going to focus even more on your weak areas, because what I find is that when people have weak areas, they tend to stay away from those areas. Like, think about it. Be real in the comments. Tell me an area. Somebody just comment, like, tell me about what are some of your weak areas. Like, for some people that may be EKG, for some people it's those just calculations, for some people terminal, like whatever your weak areas is. Do me a favor and comment that in the chat for me, whether you're watching on YouTube. Let me check on my Instagram, people. Instagram or Facebook. Just do me a favor and comment. If you don't mind sharing, comment what some of your weak areas are. Somebody said EKG. Let me go to these comments here so I can see both Facebook and YouTube. And so the thing about when you recognize those weak areas, even if you don't realize it, sometimes you unconsciously stay away from those and you don't study it. I can't tell you how many times I've had sessions with somebody who got on and they like, I can't stand EKG. I haven't looked at it. Like, it makes me nervous. That's your weak area that you want to focus on, whatever that is for you. So some of y'all saying administration, somebody said math, somebody said terminology, and I get it. Trust me. Listen, my weakness is math. My weakness is math, you guys. So I get it. So this is why I say, don't stay away from those areas. run toward that area, okay? Do what you naturally don't want to do, which is go to that area, focus on that area, and make sure you know it, okay? And then of course your strong areas, of course you still want to review those as well, but really hone in on studying those weak areas, especially if you failed the test already. If any of you are watching and you already failed the test before and you're about to take it again, you definitely want to look at your score breakdown, and study those weak areas again. All right, let me come back over here. So another thing that I suggest is using flashcards for your key terms. So I know many of you guys probably already have flashcards for like your terminology, like you probably have like your suffixes, flashcards for that, your prefixes, your root words. But I also recommend using flashcards for any key term. So you guys notice I just mentioned like AOB, EOB, COB. Those are the type of key terms as well you might want to have written down, like OSHA, HIPAA, just everything that you need to know, key terms that you need to know. And I recommend having one side, you have what the key term is, and on the other side, you have the answer to it. And so that way, when you have those flashcards, and you know how I always tell you guys, have somebody to quiz you, you can have that person to quiz you. And that's actually going to take me to the next tip that I'm going to give you, was study with a group or a partner. So when you guys do have those flashcards for your key terms, just study with someone, either in a group. One of the things that I love about my class that I currently have now, because you guys know I get a different class every semester, I love that they form groups. Like those, like my class, they study. I see them all the time in class talking about studying, and they get together outside of class. And so I don't know if you guys are still in school, if you have classmates you can study with, or a partner, or even if you just make your key terms and your significant other quiz you, or your mom or your kids, just have somebody to just quiz you from those notes that you've taken. Okay. Another big one here is to make sure you are very much familiar with anatomy and physiology. Okay. You need to know your anatomy and physiology. And not that everything else is not important, but as a clinical medical assistant, and even on the administrative side, for anybody that's taking the CMAA or the CMAS, which are the administrative tests, even you have to be familiar with anatomy and physiology. You got to make sure you know the body systems, what each body system is responsible for, as well as each organ of that body system. If you're listening to me right now and you're like, you know what? I don't know what the endocrine system does, or I don't know what the integumentary system does. Guess what? You need to make sure you go and go back to your notes, whatever notes you took in school, your textbook or whatever, and make sure you know that. Or you can get my online study guide. I go through all of that, all of those lessons and stuff. So make sure you are very familiar with anatomy, which is the structure of the body, okay? And then physiology refers to the functions. And make sure you know some diseases and disorders of the body when you hear it. So if I was to say, hepatitis, or no, not even me, but I mean like a question on a test. Hepatitis is a disease of which system? You need to know that. Okay. What's another one? Encephalitis. Which body system is that a condition of? H. pylori. And I'm asking you these because I want you to put them in the comment. H. pylori. Which body system is that? And if you're hearing this and you're like, I don't know, you need to go find out, because I've seen those specifically asked on the practice test. What else? Make sure you know. What else? Arthritis. What else? What else is another one they may ask you about? It's quite a few. It's quite a few, but just make sure you familiarize yourself with some diseases and disorders. Another thing I'll say to this that I didn't make a note of here is also make sure you know the different types of infections, okay? Like whether they're viral, bacterial, fungal, okay? All right, so let's go to the next one. Focus on clinical procedures and guidelines. Now, why do I say this? Because we looked at that test plan yesterday. We looked at the test plan for the CCMA. We looked at the test plan for the RMA, and we looked at the test plan for the CMA AAMA. And guess what? The majority of each of those tests was what? Clinical procedures. So that means you got to make sure you know vitals. That means you got to make sure you know how to do ear irrigations, eye irrigations, vision and hearing exams, assisting with pap smears and pelvic exams. You got to make sure you know how to, what else is on there? Your each examination technique, your positions, all of your clinical procedures and guidelines. You need to know all of that clinical patient care. You got to know all of that. You got to make sure you know all of that. What goes in what part of the medical record? What goes in social history and family history, right? Past history. Make sure you focus on those areas, okay? Because it's the majority of each test. All right, let me take that one down. Now this is one I'm going to tell you guys to stay healthy and manage stress. Now I know this is kind of probably easier said than done, but I want you guys to really take care of yourself when you are getting ready for the test. I know that I know it can be stressful. I know it's a lot. I know it's a weight on your shoulder that you cannot wait to get off. However, you got to take care of yourself. Get your rest. Drink plenty of water. Eat healthy. Okay. Manage your stress by creating that study schedule, because guess what? Sometimes you get overwhelmed because you just have too much to do. But when you can, again, like we said, break it down into chunks. You want to study this at this time, this day, break it down into chunks, because sometimes stress is self-induced. Like we stressing ourselves out because we're so overwhelmed, because we're all over the place. So I want you guys to really take this time. You know, some of you guys are testing this week. Some of you guys are testing next week, next month. In this meantime, just still continue to stay healthy and manage your stress, guys. Listen to music, pray, meditate, whatever those things are, and get a good night's rest. I should have added that here. Get a good night's rest. Matter of fact, let me add that here. I really want you guys to get a good night's rest the night before. Let me type that in here really quick. Study tip. Well, actually, I'm going to add that to this one. Let me hide it for a second so I can edit it. So then manage stress. No, let me add it as its own. Get a good night's rest. Get a good night's rest before your test. That night before, okay. Get a good night's rest. Let me see some of these comments coming in. Okay, so these are some of the tips that I want you guys to just apply. And also, I do have where is that free? I have like this just a download where you can, some of it is probably still the same, but I have just some tips that I didn't mention here. I'll put that in the comments, but this is the link. It's just a free download, and it's study tips. Just something quick I created. And then I got a few more tips I'm going to give you, but these next few tips that I'm going to give you, this is regarding while you're taking the test. Okay. So let me just recap those other tips really quickly. So we said you're going to familiarize yourself with the structure of the exam. You're going to make sure you got that test plan, right? You're going to go Google and download the test plan. We also said you're going to create a study schedule. Okay. You're going to break everything down into chunks instead of trying to do everything in one day, and you're all over the place on one day. Today you're doing anatomy and physiology, and you're doing dosage calculations and EKG. No, break it down, okay, and guard your time. Turn your phone off. And then what else did we say? We said we're going to use the study materials for the exam you're going to be taking. My online study guide is an option. Also, you want to take practice tests. I will mention, I think I already mentioned it a few times though. My practice test has over 400 practice test questions, and I will eventually be adding more. We also said we're going to focus on those weak areas. You want to use flashcards for key terms, not just terminology, but all of your key terms. And one thing I recommend, if you're trying to figure out which key terms, you can probably go by topics to create your key terms. You know how I mentioned AOB, EOB, and COB. Those are terms regarding administrative, like billing. So maybe you could say billing terms, or maybe you can break it down into, anatomical terms and stuff like that, right? So that way you can kind of go section by section as you're studying, and then create those terms like that, as opposed to just trying to figure out which terms. Go topic by topic. So anatomy and physiology terms, law and ethics terms, so like negligence, assault, battery, duress, all of those, create flashcards for those key terms as well. Then we said you want to study with a group or a partner, review anatomy and physiology, focus on clinical care. You want to stay healthy and manage your stress. And now let's get into some testing tips, okay? So listen, while you're taking your test, you are going to answer your easy question first and do what with the harder ones? What you going to do with the harder ones? You're going to flag them. Okay? You want to flag them so you can come back to them later. Why? Because one of the most common reasons why people fail their test is because they run out of time. So many people I've had sessions with that failed the test was because they ran out of time. Even though you get 3 hours for the CCMA, those 3 hours go by quickly, and you get even less time for the RMA. If you're taking the RMA, you only get 2 hours. So guess what? You need to, any question that you got to think about, flag it and go to the next one. I had a student who the test turned off on her, but guess what? She still passed because she had answered enough correct answers. So when you answer those easy questions first, you have less risk of running out of time. And even if you do, you probably got them all right. So even though you ran out of time, you answered enough correct. Y'all get what I'm saying? If you try to spend too much time in the beginning with the hard answers and you run out of time, you haven't got to enough questions to be able to pass that test. So I want you guys to really make a note of that. Flag your hard questions, any questions, because somebody asked me, well, how do I know if I need to flag it? You know you need to flag it if you got to think about it. If it's going to take you longer than a minute to get through that question, go to the next one. All right. Another thing, pay attention to keywords in the question, okay? So as you're going through your test, pay attention to keywords. Like, what was the first thing you're supposed to do as a medical assistant when you come in the office? What do you initially do after a procedure? What do you do first when you get patient results over the fax machine? What do you do first if you're doing an EKG and you notice an abnormal reading? What do you do first if the patient is on the stress test, getting a stress test, and they start complaining about chest pain? Pay attention to those keywords. What is the first thing? What is the initial thing, right? Pay attention to keywords in the question and read the questions carefully. That's one mistake that I've seen people, my students specifically make, is answering too quickly and not reading the entire question. And also read all the answers as well. Okay, read all the answers as well. I'm going to add that on here because I didn't make a note of that. And also, well, this goes with that one. Reading all the answers goes with this one. Use the process of elimination. So you want to go through and you want to eliminate answers that you know are incorrect. Okay, you want to see some answers. You're going to be like, oh, nah, I know this ain't it. I know this is not the correct answer. So you'll be able to just get rid. Let me put this link in here. Somebody said, can we use a calculator? So it depends on where you are. Most places won't let you use a calculator. When I took my test and I took the CCMA back in 2018, they had a calculator on the computer. So it just kind of depends on where you are. They had a calculator on a computer. All right, let me go through some of these questions. Let me go back up. So that's that, guys. I just wanted to give you guys a few tips. I'm going to do a separate video on tips for people who specifically have testing anxiety. I want to do a different video for that because these tips still apply. So if you have testing anxiety, these tips still apply. However, I know it's a little bit different when you have test anxiety. And if anybody's wondering what that is, that just means some people, they do great in school, they do great with their work, but when it comes to testing, they have a really, really hard time. All right, let's see. While you can want to know if anybody else has recently taken a CMAA exam. And don't forget, while you got, I know you weren't here last night. I'm going to do that study material tomorrow. I'm going to do a few open-ended questions for that tomorrow. And congratulations to everybody that commented and said they passed their test. Congratulations. Annie passed today. Congratulations. She's been out of school for 8 years. CMA November actually got bought your study guide, recommend people. Oh, thank you. I'm gonna can I highlight your comment? Ashley says she bought my study guide and she does recommend people to get it. She said it's very helpful. That's good to know, Ashley. Thank you for sharing that. Sinus, please wish me luck. Good luck. All right. Let's see. I just want to answer any questions before I go. I know I've seen a couple questions. Hey, I am Simone. I'm glad you made it too. Congratulations, Alejandra. All right, let's see. Do you recommend doing your teacher course that I bought and the NHA study guide? So Ashley, honestly, I put so much in there. It's up to you. If you want to just, if you do the study guide, if you do one, I would say get their practice test versus their study guide, to be honest. So if you want to still get their practice test, that would be beneficial. You don't necessarily have to, but the more practice tests you take, the better, because you'll be able to test yourself, your weak areas, and then it exposes you to even more possible questions that can be on a test and even more material that can be on a test. So to answer your question, I don't think you necessarily need to, but it would definitely be beneficial. And I always recommend you guys to get the study material. Even with my videos, even with my study guides, I always recommend the practice test for the test you're taking in addition to that. Let's see. Oh, Taisha said, I don't remember anything I learned. It was all hybrid. So Taisha, you might want to check out my study guide is it's a refresher course as well. So you may want to consider getting that, just because everything that you learn in school, I just do it in a quicker way. It's literally a refresher course. It's for anybody that already went to school and they need a refresher because they're about to take certification or they've been out of school for a long time. As a matter of fact, I'm gonna put that back on the screen here. Let me see, share screen. I'm gonna just put that back on the screen. Where is it? Yeah, I'm gonna just put that back there and let me fix the screen here. I'll just do, let me see. Yeah, I'll just do that. So I'm gonna just keep that there on the screen for anybody that needs it. All right, let's see. Crystal said I told them to watch your videos. Can't go wrong. Yeah, listen, they're here. Watch them. How soon should we study? Don't want to cram. So Taisha, kind of depends on when you're taking your test. I definitely don't recommend cramming, because when people cram, they usually mean that they are just memorizing, they're not absorbing. So I recommend, it kind of depends. You can, depending on when you're taking your test, I would say maybe I think like a month is good. If you don't have a month and you only have a couple weeks, then you really just gotta really, be intentional about that time. But when you have about a month, that really gives you like 4 weeks to just kind of get through it without stressing yourself out. So I would say about a month is ideal for me. But like I said, if a couple weeks can be done, because to be honest, my students, the program that I teach for, that class is accelerated. So they really don't get an entire month to prepare. They really technically get maybe about 2 or 3 weeks to prepare. Let's see. How many questions? Oh, as many as you need to, Ashley. You can flag as many as you need to. She said, how many questions can you flag? As many as you need to. There's no limit. And then what happens is when you guys flag your questions, when you finish your test, it'll bring you back to all those questions you flagged. Let me come back to Instagram. Oh man, I was missing comments on Instagram. Congratulations, Elite. I don't know if you're still watching. What if you don't know the answer after coming back to the ones that you don't know? Guess what? I think is it L or Ellie? Guess what? You got a chance just by guessing. So she asked a good question. She said, what if you don't know the answers after you come back to the ones that you don't know? Then you just going to take a guess. You got a better chance of getting it right when you come back and you got that time to think. But that's going to come back to process of elimination, because it's going to be something in those questions, even the ones you don't know. It's going to be options that you know is not the answer, right? There's no way around that. You're going to know something. You're going to know at least one of those options. You're going to rule that out, and then you got a chance of getting it right. You never know. And then all else fails, just take a guess. I always say, don't leave anything blank. Take a guess. You got a better chance of, one of my students, she used to say, I just choose C. I said, the answer is not always C. I don't know who took, there's a lot of people that believe that. Just choose C. And I'm not telling you to do that, I'm just telling you what one of my students said. What online test studies do you recommend? I like if I get it wrong, would allow me to review only the wrong answers. Do you recommend? I like if I get it wrong, it will allow me to review only the wrong answers. What online test studies do you recommend? So my own, definitely marefreshercourse.com. And also, and one thing I'll tell you guys about my refresher course, so it'll show you the wrong answers, but I'm actually creating videos to explain. You guys know how in my certification videos, how I go through and explain why the answers are wrong. I'm adding that to my study guide as well. So I've already did one module where the quiz, when you're going through the quiz, it already shows you, what was wrong, what was right, but it doesn't explain why. So what I'm doing now is going back and adding videos, just going over the test. I'm doing a screen recording and going over and explaining why. But I think SmarterMay does that, Emily. If you're familiar with SmarterMay, I believe they have something like that. How do I become smart from dumb? Studying. I don't even know if that's I don't know if the person is really asking that or what, but studying, really. Everybody had to start somewhere. And I wouldn't necessarily say dumb, but just not knowing, just studying. Yes, Taisha said, I can't remember anything I learned. Try my MA refresher course, Taisha, and see how that helps. Helen, I don't know if it's Helene or Helen. I'm sorry if I'm saying it wrong. She said they didn't let me use a calculator. Yeah, most places won't. The majority of people that I've heard from, they didn't get a calculator at all. My testing site, like I said, they let us use a calculator on the computer. And do me a favor, guys, if this video is helping you, do me a favor. If it was helpful, can y'all like the video for me? I take my test October 21st and your videos are helpful. That's good to know, Alicia. Thank you. I'm glad you're here. Emily, you might want to, it might be on your end. I think, is anybody else not able to hear me? It might be on your end, Emily. How can I get your study guide? marefreshercourse.com, Quizm. marefreshercourse.com. I'm going to put it in here in the YouTube chat. For some reason, Facebook, I don't know what's going on with Facebook. I can't even do it on Facebook. Whenever I put my landing page link on Facebook, it comes off. So I'm just going to put it in the YouTube chat, marefreshercourse.com, for anybody that needs it. Because Facebook, I don't know why Facebook does that. All right, I'm going to answer a few more questions and then... Oh, L asked the same question. What do you do? Okay, I answered that. When study guide didn't have a lot like you did, and it was errors. Oh, Ashley, listen, you are right about the errors. A lot of it differs from the book and the online study guide. Actually, it was me and some of my students noticed that. I used to do group sessions earlier this year. I would do one every month. I just haven't had time to do one. And we were on a group session one time and realized that there are a lot of errors. Yeah. So actually, if anything, I would say maybe get the practice test, if anything. But the study guide is literally like just going through modules, just teaching you. But I would, if anything, I would get the practice test or nothing at all. Like I said, I put quite a lot in there, and I use NHA. I use all of the test plans to create my my study guide because I wanted to make sure everything was covered. Hey, Heather, I'm glad to see you too. Heather's one of my regular. She's on here every night. Quizm is on here every night. Hey, Nalim says, I bought the study guide, but there's no option to download or print it out. Yes, you're correct. So for anybody that's considering it is not a downloadable. There are some handouts on there, but any of the handouts that I include on there, those are handouts that are readily available online, but I do not have anything to print or download. And I'm gonna be honest with you guys why I don't, because there are study guides going around that are being repurposed and branded as their own. So I do everything online. This is why people reach out and they ask me, are my videos, do I have any printed versions of my videos? Everything I do is online. Now, eventually I am going to create like a physical study guide book, and it won't be able to be repurposed, but I don't have anything that's downloaded, unfortunately, except the handouts. Now I do, you can always, make notes or type something up and create like a download and printable yourself. But I don't have anything that's printable or downloadable. Even the videos, there's an option to make those downloadable, but I just can't. Unfortunately, Nylam, people steal and they repurpose as their own. I've had people in my group. For those of you that don't know, I have a Facebook group. It's called the Medical Assistant Lounge. And I've had so many people in there come in there and repost just printed stuff from the NHA, from other people. One of the ladies in my group, she created a very nice study guide, printable study guide, and she sells it. And somebody made copies and passed it out. And so I'm an author, guys, and I write books. I've written 4 books, and I can't tell you how it feels when somebody passes your stuff around as if it is their own. Your words, your work, your creation. And so unfortunately, some people made it bad for others. Congratulations, Annie. Quizm says she just asks, is it in paper format? No paper format. Eventually, I'm going to do a book, like a study guide book, but that's going to be the only thing. And that's going to be something that won't be able to be copied. If I do downloads that can easily be distributed, and I'm not doing it. I see it in my group. I've had to, ban people from continuously doing that, remove it. I'm sorry, guys. I can't do the downloadables. Oh, Ashley said I have the practice and the final practice. Alexis, hey. So you say a month is a good time to study your guide. I feel with me working and getting my work done, I need to just focus on studying for a whole month. So I think a month is good to go through each topic. So Alexis, you have my study guide, right? So when you study, and that's not to say you need a month. You can do it in less than a month, but I just feel like a month is ideal. But then again, if it's fresh for you and you will forget. So listen to me, guys. I said a month is ideal. However, if you're going to forget that information really quickly and you want to take it while it's fresh, soon as you finish school, and you I don't want no more than a week or 2 weeks to pass, then do that. You don't have to wait a month. Just do what you can in those 1 or 2 weeks. So not necessarily a month, but I just want you guys to have enough time to, like Alexis has my study guide. So Alexis, I recommend, again, downloading the free test plan and then using that also as a guide. So, okay, I went through this part of the study guide. I learned this. Okay. And you might look at the test plan and say, I don't remember this. Let me go back to Miss K video, whatever, for this part, because I don't remember this, But yeah, a month is a good time to just kind of take your time with it. But listen, some people can't wait that long. I've had quite a few students that take it right away. They don't wait. So I don't want you guys to think that I'm saying that a month is what you should do. Never heard of it, SmarterMay. Yeah, a lot of people use SmarterMay. I'm biased though, Emily. I am, of course, I have a study guide, but I can keep it real and say that SmarterMay has been around longer. I've only created my study guide a few months ago, and I'm actually still working on it, still adding stuff to it. And SmarterMay, they've been around for a few years. So I can keep it real with you, but I'm biased. I think mine is the best. All right, y'all. I'm gonna get ready to go. We 45 minutes in. Anybody have any other questions before I let y'all go? Let me show y'all my stuff one more time. My medical assistant mug, y'all. All things medical assistant. I got my pillow here, my medical assistant pillow, and my certified medical assistant t-shirt, and my stethoscope necklace. All these goodies, all my goodies. I just wanted to show you guys. I'm going to put that link in there one more time. Any other questions, ladies and gentlemen, quickly before I get off here? Let's see. If you haven't already, make sure you like that video for me, guys. Somebody asked me how can they do something for me and pay me. I said just like the video. That's all you can do. Cut mugs. Let me put mugs. How do you know when you're the thing went up? How do you know when you're ready to take the exam or retake it? That's a good question. And I answered this on a video before. Somebody asked that question. And I can't even remember what I said, but let me think about that for a minute. How do you know when you're ready? Definitely after you've gone through your weak areas. So if you have to retake the exam, definitely after you've gone through your weak areas. And one thing I always say is you want to be able to answer open-ended questions, L. You got to be able to answer open-ended questions. If you can only answer questions correctly when it's in multiple choice, then you are relying on seeing those options. You're not really absorbing it, you're memorizing. So I would say when you can answer those open-ended questions, like you really know you're ready. And that's one of the reasons why I started making my videos open-ended versus multiple choice. First of all, it's easier, but then it also helps you out more. So I would say definitely once you've gone over those weak areas, when you can answer open-ended questions, and when you feel it, like you'll know it, you'll feel ready, you'll feel excited about it, you'll know it, you'll know. Oh, thank you, Heather. Simone said, thank you for all the gems. You are so welcome, Simone. I'm so glad you made it. She said, because I saw you earlier say you finally made it live. I'm so glad you made it live. She said, I just started school, so have you ran across your content? I'm so glad too, Simone. Welcome. What is your video about tomorrow? CMAA practice. So anybody that's taken, thank you for asking that, Quizm. So tomorrow, CMAA practice is for anybody that's taking the administrative exams. That also helps for the administrative part of the CCMA and all the other clinical exams. Okay, so that stuff tomorrow is going to be all administrative questions. So even if you're not taking the CMAA or the CMAS, the administrative, they still help because each of the tests, they all have administrative questions. Yes, ma'am. Wolf, I try to tell you it's part of our assignments, but I want to go back and re-go over it. Or we just focus. Okay, got you, Alexis. The NHA study got what not my. Okay, I feel you. I get it. So you guys have both, Alexis. You have the NHA study guide too, and mine. And on my learners, I've been having difficulty with it. They do like real life. Oh, I didn't know you guys had the NHA study guide as well. Tawson, what's your question? Oh, okay, I see it. My MA course took me 4 months and I passed exam, but yet I don't feel. I've heard that before, Tawson. So Tawson asked a good question. Tawson says my MA course took me 4 months and I passed the exam, but I don't yet. But yet I don't feel competent. Let me make a note to address this in another video because I've had a few people ask that. And I do have an MA refresher course, Tawson. If you feel like you don't feel competent, as in you didn't absorb the information, you can try that. But if you mean like as far as your clinical skills, you want to just look at videos of the clinical skills. And then when I don't know if your school is helping you find a job, but just try to find an office that is willing to train you. Okay, for your hands-on skills. Let them know you didn't get a lot of hands-on training or any at all, and if they would be willing. But I'm gonna answer that. That's a loaded question that I've addressed before, but I'm gonna do a separate video. So let me, for some reason, it won't let me copy your message. but I'm just putting it up on the screen so I can come back later and screenshot it. I did well on your last open-ended. Oh yeah, you did, Elle. You were here too. Should I get a degree like associates or LPN? It depends on what you want to do, Toss. And you have to think about your long-term goals. So if you know you want to work your way up and you want to go on into nursing, then definitely yeah. So if you want to do, especially if you know you want to go to nurse practitioner or PA one day, definitely. And it's yeah, so that depends. And I did answer that question on another video. Should I become a LPN or RN, or should I get my associates or my certificate? I did answer that question before too. Good questions, Tawson. Very good questions. I just have I've just addressed a lot of those before, so I will recommend checking those out. But as far as that one, the other question you asked, I'm definitely going to do a video on that one because I've seen that a few times. Your videos and quizzes seem better for me learner-wise, and the knowledge check is great to test my knowledge. Perfect. Thank you for saying that, Alexis. That's so glad to know. The knowledge check questions. See, that's the thing. Those open-ended questions really test your knowledge. Thank you for sharing that, Alexis. On anatomy and physiology, do we have to know everything? Yes. Yes, Ashley. Yes. You don't know what's on there, but you do got to know everything. Yep. Ashley asks for anatomy and physiology. Do we have to know everything? Yes. Every single body system and the structure of the organs of each body system and what they're responsible for. Yes, you do. Yep. Which one is better, the CMA or RMA? So I would not say either is better, Talita. The CMA is considered the cream of the crop. It is a 5-year certification, and it is I don't want to say it's necessarily harder. I've heard that it is, but I wouldn't necessarily say that because the RMA is kind of challenging as well, but it just kind of depends. The CMA is 5 years, the RMA is 3 years. And I did a video breaking down the differences between each one. But I don't want to say one is better than the other because they're both widely accepted. Like you won't find anywhere that's going to say, oh, no, I don't want the CMA or I don't want the RMA. But I will say this, the CMA through the AAMA, that is the one that, like I said, they consider the cream of the crop of certifications. And you will never have an employer that's going to say, no, I don't want that. Even though the employer takes all of the certifications, there are some employers and companies that will favor one over the other. And the CMA and the RMA, they tend to be the top certifications. She said like word for word. Well, word for word, like meaning, are you saying like word for word, like how I break it down in my study guide? Well, I mean, you got to know everything, like every body system, the structures of it, and what each organ is responsible for, and then also recognize the terminology for that word, the medical term for that word. So like HEPA and, nephro and renal, like all of that, and then also some diseases and disorders. So yeah, actually, it's a lot. That's why I put that as one of my tips. Make sure you're really good with that anatomy and physiology because that's a big portion of the test. So yeah, it's a lot, but it's a lot. An anatomical direction is like this on anterior to the body. I struggle when it asks the elbow is distal to the hand. What's the best way to understand that? Okay. So Heather said, what is the best way to understand the anatomical directions? Honestly, the best way is always listing them. With the opposite, right? So always list distal and proximal together, right? Distal is farther away from the trunk of the body. Proximal is closer to, okay? Anterior is toward the front of the body. Posterior is toward the back. So remember them in pairs. Don't just go from distal to anterior or from proximal to posterior or, inferior to superficial. Remember them in pairs. Okay, that's going to be key. That's how you remember those. Okay, anterior, posterior, distal and proximal, superficial and deep, inferior and superior. What else? Am I missing anything? I think that's it. Distal and yeah, I think that was all the directions. But yeah, just remember them in opposites. I struggle with taking down notes. How can I show? Okay, I'm gonna have to do that on I'm probably gonna have to address that on another video because I I'm not exactly sure. Just key thing. I would say maybe key things. I got to think about that one, Ashley. I'm not sure. How can I shorten my notes? I don't know. Maybe just writing down like those key things. I'm not exactly sure. I got to, Ashley, let me get back to you on that one. Let me think about that one. I've never gotten that question. How can I shorten my notes? Anybody got anything to add for Ashley on that? Ashley says, I struggle with taking down notes. How can I shorten my notes? I know flashcards is one way. You know, but does anybody have any suggestions on shortening notes? Anybody? I'll wait a couple minutes and see if anybody has anything to add. One thing too, if anybody wants to ask a question, anybody wants to come on and ask a question, I'm gonna put the link here. And you don't have to come on camera or anything, but you can just share your audio. So I'm gonna just put that here for anybody who wants to do that. It's a StreamYard link. If anybody wants to ask anything or say something, that's the link. I'll wait a couple minutes, and if not, I'm going to get on up out of here because I've been talking all day. My MA instructor says we need to keep redoing our NHA modules to do well on the test. Do you think so? She's probably referring to the quizzes. I do tell my students to redo the quizzes until they get, the goal is 100%, but they have to have at least an 80 to go to another module. So if that's probably what your instructor is talking about, I don't know if she is saying you need to go through the actual modules, but if that's what she's saying, then she probably has her reasons. But I do have my students to go through the when we were doing the study guide. Now we're doing, I have my students set up on my study guide, but before we were doing an NHA study guide, and I would have them redo the module quiz if they didn't get at least an 80, and then keep doing it until they get a 100%. So they had to get an 80 to get credit for the assignment. And then I just told them to go back as a challenge for themselves to keep doing it until they get a 100%. Will shorten your notes be like open-ended questions, just know the answer, or the certain topics being asked? I'm not exactly sure. Open-ended. I'm not exactly sure, guys. That one stumped me. I'm sorry, y'all. That one stumped me. Simone said maybe take what you feel may be important or what sums the topical keywords that stick out. Yeah. I love your practice test videos. I'm on video 6 now. Awesome, Susan. Okay, guys, I'm going to get ready to get out of here. I fried some fish and I made some potato salad. So I'm going to get ready to eat in a minute. Thank you guys for hanging in there. Again, we're going to do CMAA practice tomorrow. So this is going to help with the administrative parts of those tests. And then it's going to help with the administrative tests like the CMAA and the CMAS. It took me an hour on one NHA quiz last night since it has to be 100%. Oh, Alexis, you're talking about the skills builder. You're talking about the skills builder because that's what you're talking about, right? I do not like the skills builder. I do not. My students have to do that too. I don't like the skills builder at all. Yes, Alexis. And yeah, at first, you know what, Alexis, I was making them do it until they got a 100%. I was having them do it. And now I'm just like, listen, just do it. And they get credit just to do it. It's too much. That skills builder, honestly. Yeah, I'm going to keep my thoughts to myself because this is a public platform, but I'll share my thoughts with Dr. Hill. And I also shared my thoughts with my coordinator at my school because I was like, I'll share what I shared with him. I told him I don't think we need to get that. I don't think we need to purchase that, the skills builder. Yeah, I don't like the skills builder because personally, from what I've seen, I don't feel like it prepares you as much as the study guide and practice test does because it's just a bunch of doing this over and over and over. And I don't see how it's really getting you ready for the test. So yeah, I know, Alexis, my students struggle too. And even one of my students came and showed me something, and I know she had the right answer. I said, "Yeah, you're choosing the right thing. What's up?" And it turned out that she had to choose. It was like four of them all together. It was like 6 or 7 options, and she had to choose all four to get it right. And I never would have guessed that myself. And so I said, no. Mm-mm. Alexa said, yeah, but I feel your thoughts. Please let them know. You see, I was, yeah, when I do my stuff. Yeah, I'll mention that too. The answer I put was right. They wanted partial name. Yep. See? See you tomorrow, Heather. Hey, Yanni. Yanni passed her test. Congratulations, Yanni. Congratulations. I'm so proud of you. Yanni passed her test. Yanni has been tuning in to these lives. Yanni has my study guide. Oh my goodness, Yanni, I'm so proud of you. And Yanni called in the other day and shared that she was about to take her test. Yanni, I'm so proud of you. Congratulations. That just made you just made my night, Yanni. And I thought about you too, because I remember you saying you were taking your test on Wednesday. I thought about you. I'm so proud of you, Yanni. Yanni, you want to call in again and tell us, give the people an idea of what all you saw on your test? Let me know if you want to do that for a few minutes. I'll hang on here for just a couple more minutes if you want to do that. If not, it's okay. I'll log out. But if you want to just share your audio again one more time with us and just kind of give us an idea of what was on there and all of that, just let me know. And if so, I'll stay on here for a couple more minutes. And if not, I'll log out. Alexa, I think that was the same question I was doing last night. That the question that she was on was was setting up a sterile field. So it was that the same one for you, Alexis? It was a setting up the sterile field, and it was like it was four different options, and she had to choose. I mean, it was a bunch of different options, but she had to choose. She had to make sure she chose all four of them. You're welcome, Yanni. Everybody said congratulations. They said, what exam did you take, Yanni? You want to call in, Yanni, again? I put the link on it. Let me post the link one more time and let me know if you want to do it. Let me copy this and then let me put it here in case you want to call in again. So you can let us know, especially for those that's about to take it. Hey, Anna. Anna, you always getting in. You always coming in the room when we coming off. But I might be on for a couple more minutes. I'm trying to see if Yanni is going to call in. If so, I may be on for a few more minutes. Oh, yep. Okay, here's Yanni. Hey, Yanni. So I'm just going to add you. You don't have to turn your camera on anything if you don't want to.
Yeah.
Hey,
Hello.
Yanni. Hi.
I'm so happy. I just took my test now, and I want to say thank you because the course, the refresher course, it was very, very helpful, and also being listening to the videos that was helpful. Like the questions,
Wow.
the content is really in the CCMA test.
Wow. I'm
Thank
so
you
glad
so
to
much.
know that. Let me ask you this, Yanni. What was so I do want to remind everybody's test is different, but like Yanni, what would you say like on your test? What did you see a lot of?
Well, I saw a lot of the EKG question, like the placements in my
Okay.
test. I also have like the kind of interference, like somatic, wandering baseline, that one, and also a lot of the values for the right temperature, the right vital
Hmm.
sign, all of that.
Wow. What about the
Mhm.
administrative stuff?
In my test, I have only a few of that part, like
Okay.
maybe 10.
Got you, got you. And you guys
Yeah.
can hear her, right? Y'all can hear her in the comments. I just want to make sure y'all can hear her. Yanni, thank you so much for sharing that. Like you have no idea. You just made my night because I literally thought about you because I remember you said you were taking your test today. And I noticed you weren't on here tonight and I wondered about you. So I'm so glad you came on here and shared that. And then, to let other people hear you and to give them some hope. So, guys, Yanni passed her test today. Let's give her a hand, some confetti emoji in the comments, y'all. People are saying congratulations. They saying yes, yay, Yanni. They
Thank
are
you.
loving
Thank you,
it.
everyone. And I want to say the videos, even the old ones that I was watching, they're all
Mhm.
helpful.
Yes. Thank you for sharing that, Yanni, because people always ask, is your old videos, are they, listen, y'all, medical terminology, that stuff don't change. That stuff do not change. It all still applies. Even my old videos from 2 years ago, they all apply. Thank you so much, Yanni, for sharing that.
Thank you,
You're
everyone. Have a great
welcome.
night.
Yanni, make sure you keep in touch and stay around and join in on us sometimes too. Don't leave me, Yanni.
I won't because I want to be a teacher
Oh,
one
you want
day.
to visit? You want? Oh, Yanni, that make me so happy. Yes, definitely stay in touch. Please stay in touch then, because I got you on that. And I love to hear when people say they want to teach. I love it. I love it.
Thank you so much for
You're
everything.
welcome. And thank you for calling in. Good night, Yanni. Congratulations again. Keep me posted with your journey and stuff.
Okay, thank you.
Okay.
Goodbye.
You're welcome. Good night. Yeah, that just made me so happy. I'm so happy for Yanni. Y'all have no idea. She got my study guide. And so anytime somebody has it, of course, I'm always like, okay, I'm hoping and praying it's helpful to them and all of that. And so the fact that, she's been on the lives these last few nights and answering the questions, it just made me so happy. And, it makes me happy anytime somebody passed from watching the videos or anything. So guys, please continue to share with me when you pass. Share your good news. As you can see how supportive everybody in the comments is. Look at that. Everybody's congratulating her. Yanni, everybody's so happy for you. Anna, hey Anna. Anna is one of my moderators in my group, guys. If you are not in my group, Medical Assistant Lounge, it is on Facebook. I am Simone said. I hear the excitement in her voice. All right, guys, let me go ahead and go because I've been talking all day. And I don't know if y'all know, but when you talk a lot, it is exhausting. So I got to get out of here so I can go eat and go to bed. I'll see you guys tomorrow, same time. We're going to go over administrative practice. Let me go on Instagram. Oh, Bianca, I'm sorry. See, I'm missing all of these comments on Instagram, y'all. Anyway, y'all have a good night. Love y'all. See y'all tomorrow, same time.